We're just going to go over how best to use a nasal corticosteroid spray. This is the bread and butter of treating complaints of nasal congestion, obstruction, chronic sinusitis. The most important thing with these sprays is to give them some time to work. So it takes at least 6 weeks and often up to 3 months for you to see the maximal benefit you'd have. You need to use it every day. And so what I usually recommend is that you put it by your toothbrush. That way when you brush your teeth, you spray your nose, you won't forget to do it. Technique's pretty straightforward. We're going to check the expiry date, make sure that the product's still good. Okay, so we're just going to go over how best to use this spray. This is ciclicinide. This is the generic version of Omneris, and this is a spray that's been prescribed once a day. Some of the sprays will be prescribed twice a day. It's important that you use them as they've been prescribed to you. The most common complaint with using these, or side effect from using these sprays, is nosebleeds. And one of the techniques that we are going to show you will help to minimize your chance of having problems with nosebleeds. If you're using the spray twice a day and you've had problems with nosebleeds, I usually recommend you give your nose about a week break and then start back onto the spray. So we're taking the cap off here. And when we're using this spray, this is a spray, it's a pump action. We want to prime it first. So one spray until we see some medication come out. And then what I'm going to do is I'm going to use my left hand to spray the right side and my right hand to spray the left side. That's going to get the medication out towards the side of the nose, which is where that inflammation is happening, where we need the medication to go. So left hand for the right side. I'm going to aim up and back towards my eye. Sniff in after you've sprayed. And then on the other side, sniff in after you've sprayed. You don't want to blow your nose right away. You don't want to blow out any of that stuff. And if you are using a saltwater rinse or spray, you want to make sure that you've used the salt spray before you put the medication into your nose.